cervical spine fusion, otherwise known as an ACDF, which means anterior cervical discectomy and fusion. Anterior means we're going from the front. Cervical is neck. Discectomy means we take the disc out, take all the pressure off the spinal cord and the nerves, and then fusion means we get the two bones to fuse together, to grow together. This is one of the most common successful surgeries done all over the world for probably 50 years. It can really treat pathology, and it's also minimally invasive and safe. So the reasons for the surgery is if you have degenerative disc disease and neck pain, pinching of a nerve causing numbness, weakness, pain down the arm, and or neurologic deficit of your spinal cord, specifically throwing your balance off or causing clumsiness of your fingers, are all typical reasons to do the surgery. A fusion of the neck is one of the most common surgeries done. In fact, we've done this surgery on about 30 to 40 professional athletes. We reported on 25 of them. We found that 80% were able to return to their sport after a single level neck fusion, and the average return to play was around 9 months. And so it gives you an idea as to it's a pretty small, successful surgery if that's the problem. So why to have the surgery? If you're having those symptoms and you haven't responded to conservative management, or if there's pressure on your spinal cord and your nerves causing a neurologic dysfunction, a lack of function, it can be worth doing the surgery to take the pressure off the spinal cord and the nerves. We typically try conservative management first. If that's not working, then it's reasonable to consider having the surgery. How's the surgery done? We go in from the front. We don't actually cut muscle in the surgery. We go in between the sternocleidomastoid muscle and your throat. Your spine is right under your throat. It's surprisingly close. And so we put a retractor in, take the disc out, take the bone spurs, all the pressure off the spinal cord and the nerves. We do that under the microscope. And as you can see, if you come in from the front, your spinal cord and the nerves are behind us. And that's why it's a relatively safe surgery, because we rarely have to really touch or manipulate the spinal cord or the nerves because all the pathology is in the front. So we actually put a metal pin in the vertebra above and below and distract the space open to create some empty space. And then under the microscope, we take the disc out, which creates this empty void. And so the disc herniation and bone spurs and pathology can fall into this empty space we've created. So there's still a risk of neurologic injury, weakness, paralysis, those types of things from the surgery, but those are rare because the surgery is done so safely and from the front where the pathology is. So a fusion basically means once we take the disc out and get rid of the problem, we got to replace it with something. We typically use a plastic spacer, some type of coating, sometimes bone, sometimes metal. We put the spacer in, which keeps the space distracted open. Then we put a metal plate on the front to stop the motion. And here's an example of a plate. 2 screws up, 2 screws down. And this is a 2-level fusion, 2 discs. And we lock it in place. I'll mention a 1-level fusion means fuse 1 disc, which means fusing 2 bones. For instance, C4, C5 vertebra, the disc is called C4, C5. If we were to fuse that disc, we call it a 1-level fusion, which is fusing 2 bones. A 2-level fusion means fuse 2 discs, which is going to be 3 bones, C4, C5, and C6, for instance. So the fusion is successful for multiple reasons. One is we directly remove the pathology. Number 2 is we have distracted the disc back open. As it degenerates, it loses height. If we distract it back open with the pins and the spacer, it also indirectly opens up the holes, the foramen, where the nerves come out. The third reason is it stops the motion. By getting the fusion and bone growth that never moves again, the bone spurs and the pathology don't come back because there's no motion occurring there. So that's why a fusion is a very reliable surgery, and that's why we do a lot of them on professional athletes, because a lot of times it'll give people their best chance for their neurologic recovery and to be able to go back to their sport and their activities of daily life the most reliable. But what's the downside of the fusion? Well, the fusion stops motion of that segment, which can put more stress on the discs above and below. They have to hypercompensate, which can accelerate the normal wear and tear that's already happening at those other levels. Therefore, you may develop pathology and problems from the next disc and have to have that one operated on. So the alternative is an artificial disc replacement, which preserves motion. But the artificial disc, by preserving motion, you can still develop bone spurs or have residual bone spurs and problems at that level. So they're both good surgeries. They both have excellent outcomes. Fusions in the neck have been shown to have 90-95% successful outcomes of really helping people with pain and neurologic deficits. As far as the surgery itself, it typically takes around an hour and a half. Most people go home the same day of the surgery. Sometimes they stay overnight. The nice thing about neck surgery is usually people are not incapacitated of any real significance. You're able to walk, move around, take care of yourself pretty quickly. Plan on not driving for 2 weeks. Just let the neuromuscular control come back. Some of the risks of the surgery, there's obviously many risks in many surgery. You can have swallowing issues from the surgery. You can have a neurologic deficit. You can have a stroke, heart attack, death from any surgery. There's always a chance that bone doesn't grow and you get a failed fusion, in which case sometimes we go in the back, put in screws and rods in the back to help stabilize it even more. Other parts of the recovery process are typically we start physical therapy and postural strengthening exercises around 6 weeks after the surgery, and you go through the whole program to get the muscle strong to protect the segment. As far as return to sports and physical activities, it typically is between 3 to 6 months. Full recovery may be up to a year because it may take 6 to 9 months for the bone growth to happen, and then 3 months of recovery on top of that. You have 2 options at this point. If you'd like to come see us in person, please give us a call at 310-448-7890, or you can email us at info@watkinsspine.com. Thank you.